Hello and welcome to Minors on Campus Required Training for Regulation 01.25.18 for programs that involve the participation of minors. Minors are individuals under the age of 18 who are not current NC State students or accepted for enrollment. Safety is a shared responsibility, and all employees should be aware of their responsibilities and boundaries in working with minors. I am Stacy Fair, Director of Youth Programs and Compliance, and this training covers all topics as required by the regulation and meets the training component for compliance with the regulation. A PDF of this presentation with notes is available on the Minors on Campus website at go.ncsu.edu/minorsoncampus. This presentation covers a wealth of information quickly. Be prepared to take notes and follow up on items that need clarification. My contact information will be listed at the end of the presentation if you have any questions. Minors regulation training is required annually for adults working in programs serving minors, and the date of this training will be recorded upon completion. The first training requirement is to review university policies, procedures, and rules, including this regulation. If you have not already, take the time to read through the minors regulation, review your program's rules and guidelines and code of conduct for interacting with minors, reference the campus resources at go.ncsu.edu/minorsoncampus, understand your program's process for incident reports for behavioral issues and accidents, know your program's policy for handling disciplinary issues. Every decision made when working with minors must be a good decision. If you have questions regarding any of these policies, rules, and procedures, ask your program leaders for clarification prior to the start of the program. Behavioral expectations per regulation. Staff and volunteers of the program shall not have contact with minors in seclusion. There should be 2 or more authorized adults present during activities when minors are present. Enter a minor's room, bathroom facility, or similar area when that minor is staying overnight in university housing without another authorized adult in attendance. Share accommodations with minors with the exception of minors' parents or guardians sharing accommodations with their own children. Engage in abusive conduct of any kind toward or in the presence of a minor. Strike, hit, administer corporal punishment to, or touch in an inappropriate or illegal manner any minor. Provide alcohol or illegal drugs to any minor. Authorized adults must also not provide prescription drugs or any medication to a minor unless specifically authorized in writing by the parent or legal guardian as being required for the minor's care. In case of emergency, call 911. Use a personal vehicle to transport a minor. Use personal text, email, or social media to communicate with minors outside of the official program. Expose minors to sexually explicit materials such as pornography. Invite minors to your home or activities outside of the official program. Give gifts to minors without their parents' or guardians' knowledge. Now we will cover risk management, best practices, procedures, and guidelines for all program activities. The most frequent general liability losses for youth programs include falls, athletic injuries, horseplay injuries, abuse or maltreatment, medical or allergic reactions, aquatic injuries, or drowning. For a list of typical areas of risk in youth programs, refer to the Minors on Campus website. When you are working with minors, your attention to their safety at all times is critically necessary. Good decisions and attentive supervision can reduce risks significantly. Avoid distractions while supervising minors. One area of risk that is common for all programs is communication and social media. Staff should not take pictures of participants or post them on their own social media outlets. Participants should not take pictures of other participants without their knowledge. All written communication should take place in a public forum such as GroupMe. No private social exchanges, messages, texts, calls, or emails with participants. Professional university staff can take photos for use in university media if the participants and parents have signed a media release. The next training requirement is the supervision plan for adequate supervision in light of the number and average age of the participants, the program activities, and whether or not overnight stays are involved. Never be alone with a minor. One-on-one meetings can take place in a populated public space. If there is a need for a private conversation, 2 program staff must be present. If it is impossible to have 2 staff members present at all times, assign an adult roamer who visits each area selectively. Leave all doors open. Ensure that doors have glass windows. Only cleared staff and volunteers can assume responsibility for the minors. Volunteers who are not background checked should never be alone with or in charge of minors. They can help out with the program, but they must be within the line of sight of an adult who has been registered and meets the minors' regulation requirements. Minors should be supervised by a staff member at all times. For bathroom breaks, check bathroom stalls and spaces prior to minors entering. If a group goes to the restroom, a staff member should stay outside in the hallway to monitor behavior. Only 1 person at a time should ever be allowed into a single-service restroom. During transitions, monitor minors closely. Do not allow horseplay. Take a head count or roll call after each transition to make sure nobody is missing. These are the supervision ratios of the American Camp Association and are considered a best practice for supervision standards. Programs may need to have extra staff available to maintain ratios all day, every day, throughout the duration of the program. Make sure staff and participants are easily identified with the program and each other. Use staff name badges, shirt colors, stickers, numbers, or team names to identify participants with their leader. Make sure minors know not to associate with adults who are not part of the program. We will now cover emergency planning. If there is a wolf alert, think through, how does this affect the program? What do parents and guardians need to know? Will this affect their pickup plans? Refer them to the NC State homepage and the on-campus app for updates. This can be downloaded at no cost and is available for all. Have a plan for a possible power outage. What would you do? For thunderstorms and hurricanes, avoid being outdoors, especially near trees and water during a lightning storm. Seek shelter indoors or in a hard-topped vehicle until the storm passes. For tornadoes, if you are notified that a tornado is approaching, move immediately to a predetermined shelter. Remain there until the all clear has been officially given by Wolf Alert, police, or local media. If you are outside, seek shelter in a nearby building or find a ditch or depression in which you can protect yourself from debris. After a tornado, be aware of broken glass, unstable structures, and debris. In case of fire, keep calm and communicate with participants. Make sure they get out. Go at least 100 feet from the building in an open area or to a pre-designated location. Get a count for your group and report important information to the authorities, such as a missing person or suspected foul play. If there's a missing participant, the leader should work with the staff to do a sweep of the area and facilities, such as restrooms, meeting rooms, residence hall, to find the participant. Call or text to contact the participant directly, or contact parents or guardians to see if the camper was picked up already or if they had contacted home. If not found, contact police. For an active shooter, there are 3 things to keep in mind. 1. Get out. Have an escape route and a plan in mind. Leave your belongings behind. Keep your hands visible. 2. Hide out. Hide in an area out of the shooter's view. Block entry to your hiding place and lock the doors. Silence your phone. 3. Take out. As a last resort and only when your life is in danger, attempt to incapacitate the shooter. Act with physical aggression and throw items at the active shooter. For public safety, keep doors and windows in overnight accommodations locked and do not allow those you don't know into the space. Walk in groups and stay in well-lit areas whenever possible, especially at night. Do not appear distracted. Remain alert. Keep your valuables with you or locked securely. Know where your participants are at all times. If you feel unsafe in any situation, trust your instinct and contact University Police immediately to report suspicious activities or crimes. Save the on-campus police phone number to your phone contacts. That number is 919-515-3000. Make sure your contact information is up to date in the campus directory. You can update through MyPack portal. Next, we will look at health and first aid. Necessary program staff should be informed of their participants' health history and medical needs. Inform parents in writing of situations when they will be notified of camper illness or injury. Document when parents have been contacted or attempts to contact have been made. Maintain records of all health care provided and reports of all incidents requiring professional medical treatment. A staff member with training in first aid and CPR AED should be on duty at all times during the program. Programs should have access to a first aid kit. If first aid needs to be administered, keep calm and move other participants away from the scene. Do not move the victim unless there is an immediate threat to life or you need to move the victim to provide care. Determine what is needed: ice pack, Band-Aids, ankle wrap, CPR. Stay with the participant until the situation is resolved. Staff should not provide medicine unless it is the participant's medicine and the participant administers it themselves. Staff should not use personal vehicles. Emergency transportation should be provided through 911. Next, symptoms of anaphylaxis and use of EpiPen. Anaphylaxis symptoms usually occur within minutes of exposure to an allergen. Sometimes, however, it can occur a half hour or longer after exposure. Signs and symptoms include skin reactions, including hives, itching, flushed or pale skin, low blood pressure, constriction of airways, and a swollen tongue or throat, which can cause wheezing and trouble breathing, a weak and rapid pulse, nausea, vomiting or diarrhea, dizziness or fainting. Participant administers their own EpiPen. Must go to urgent care even if symptoms improve. The EpiPen may only last 10 to 20 minutes. For medicine, store medicine in Ziploc bags with the participant's name, picture, name of the medicine, and dosage on the front. There should be a form inside the bag to track usage. The medicine must be in its original container with the dosage printed on it. The participant should state their name, the dosage, and what the medicine looks like before they take it. Staff should not administer medicine. They must monitor the participant take it themselves. Staff should not purchase medicine for participants. If there is an emergency, contact campus police. Now we will move to child abuse identification and reporting. Based on the statistics shown, we know that child abuse is prevalent in the community and exists even in higher education. Abuse thrives in an environment where adults are inattentive, in denial, or afraid to take action. We must actively work to prevent it and take steps to create a safe environment for minors. The earlier that abuse is identified and reported, the better the chance of recovery for the minor. When we look at the portrait of an abuser, specifically a sexual abuser, most are known to the victim. The abuser could be a family member, a friend of the family, a teacher, older youth, coach, counselor, or another child under the age of 18. Some abusers are careful and calculated about the process they take to earn the victim's trust. This process of slowly introducing a child to sexual activity is called grooming. These abusers set up the situation so that they can take advantage of the child. They become friends with potential victims and their families. They earn trust and seek time alone with the children. Sometimes they spend time doing what the child wants. Sometimes they give gifts. Their goal is to spend time with the child in one-to-one situations. Then they may threaten or force the child to participate in sexual contact and maintain secrecy. Some abusers take advantage of a situation and opportunity to find and abuse a victim. These abusers are impulsive and abuse minors to meet their own sexual or control needs. The effects of abuse have long-lasting emotional impact. Abused children can blame themselves, lack trust, have difficulties forming relationships into adulthood. Often, these children feel that they are worthless or damaged at their core. As an adult, this may cause the victim to fall short of reaching his or her potential and puts them more at risk for abusing other children. The effects of child abuse not only affect the individual, but current and future communities. We will now look at the 4 types of child abuse. Physical abuse is a non-accidental physical injury ranging from minor bruises to severe fractures or death as a result of punching, beating, kicking, biting, shaking, throwing, stabbing, choking, hitting, burning, etc., inflicted by a parent, caregiver, or other person that has responsibility for a child regardless of intention. Emotional or psychological abuse is a pattern of behavior that impairs a child's emotional development or sense of self-worth, including constant criticism, threats, rejection, exposure to domestic violence. Neglect is failure to provide for a child's basic needs, including physical, medical, and emotional. Sexual abuse is any sexual act between an adult and a minor or between 2 minors when one exerts power over the other. The risk for sexual abuse on a college campus requires a closer look. Sexual abuse doesn't always involve bodily contact. If an adult engages in any sexual behavior with a child to meet the adult's interests or needs, it is abuse. Indecent exposure, exposure to pornography, exploitation through prostitution or the production of pornographic material, sexting and other communication in a sexual manner over the phone or internet is abuse. Sexual abuse can occur between members of the opposite sex or members of the same sex. Sexual abuse is a crime. Aiding and abetting a sexual offender is also a crime. All child abuse is an exploitation of a child's vulnerability and powerlessness in which the abuser is fully responsible for the actions. Be aware of these possible warning signs of abuse or neglect. A warning sign is an opportunity for prevention and a chance for you to recognize a risk to a minor. Abused children may display a wide range of physical or emotional symptoms. While these symptoms do not necessarily indicate that child abuse has happened, they combine to raise your level of concern about the situation. Also know that sometimes there are no warning signs. Warning signs can differ by the age of the minor. A child is more likely to suffer abuse or neglect in the home than at a camp or program. A child who feels safe at camp may disclose to a trusted counselor that a relative or caregiver is abusing them. If participants disclose personal information that causes alarm, we must report it. During a disclosure, avoid denial. Provide a safe environment for the child, reassure the child, and make sure to really listen. Do not make any assumptions, do not interrogate, and don't make any promises. Document exact quotes, be supportive and non-judgmental, and seek advice. There are only 4 questions you should ask. What happened? Who did this to you? When did this happen, and where were you when this happened? Asking any additional questions may contaminate a case. Always report it. Due to the sensitive nature of this type of report, it is important to maintain the highest level of confidentiality and professionalism. Our next training requirement is to review the procedures for reporting incidents of suspected abuse or neglect, or improper conduct. It is a state of North Carolina law that any person or institution who has cause to suspect that any juvenile is abused, neglected, or dependent, or has died as a result of maltreatment, shall report the case to the director of DSS in the county where the juvenile resides or is found. There are 3 phone calls to make. The law requires that the Department of Social Services be notified. On NC State's campus, you must also notify University Police and the Risk Assessment Case Manager. Our last training requirement is to review the guidelines for protecting minors from emotional and physical abuse and neglect. We do this by respecting the rights and dignity of all individuals, being alert for peer-to-peer misconduct or bullying. There is 0 tolerance for bullying. It must be identified, addressed, and documented. Setting expectations for participants that encourage peer-to-peer friendships but discourage intimacy or sexual behavior. And by being alert for signs such as one child avoiding another, a child crying, looking like they've been crying, 2 children leaving the room together, and other indications that seem not right. Be sure you are aware of the procedures in place for reporting and dealing with incidents between children from the slight to the serious. Thank you for your attention to the Minors Regulation training. There is a short quiz that follows, and contact information is on the next slide. All the best to you and your program.